This is the Medical Minutes Podcast on the All Indiana Podcast Network. Your source for the latest news, updates, information, and more from the world of health and medicine. Now, here's Wish TV's medical reporter, Dr. Mary Gillis.
From Wish TV, I'm medical reporter Dr. Mary Gillis, and this is Medical Minutes on the All Indiana Podcast Network. First, the test was positive, then it came back negative, and now the results are positive once again. This is what doctors are calling COVID-19 rebound. In this week's episode, I speak with Dr. Christopher Doehring, Vice President of Medical Affairs at Franciscan Health. He tells me about COVID rebounds, how common they are, and the link between rebound COVID and the antiviral drug Paxlovid. Our conversation is next. All right, Dr. Doehring, what's a COVID rebound case, first of all? And then I want you to tell me what the relationship is between a rebound case and then Paxlovid.
Yeah, so that's a great thing to try to determine the distinction between a rebound case being somebody who's still sort of in their current infection. Their testing actually can become negative, especially if they've been treated with Paxlovid, but then their testing would return to being positive after they've stopped taking the medicine. So very much similar to what President Biden experienced. That's in contrast to a reinfection that happens, within weeks or even a month or two of a past infection, which would be two separate infections in that scenario. But that's kind of the difference, and we are seeing this rebound phenomenon in seems like maybe up to 10% of cases of patients who've taken Paxlovid.
And what does this mean? Has it not cleared their system? Is it stops when they or it's reemerges when they stop taking the antiviral drug?
Right. So Paxlovid has it's an antiviral medicine. It suppresses the reproduction of the virus, and so in a short period of time, it helps your body sort of either clear the virus or your immunity builds up to the point where it can handle what's left. The problem is, in some cases, when that medication is no longer being taken, the virus can then come back to a level where you can test positive for it, and that's what's happening in most people. Some people get symptoms again, but some people it's just a testing phenomenon that they went negative. They were actually recovered clinically, but then a subsequent test would come back positive. So that's kind of the scenario that we're seeing play out with the rebound phenomenon.
And how common are rebound cases? I think you said 10% we see, or?
Yeah, I mean, we've heard it characterized as rare. I think at this point we know it's probably not rare. It's not common, but it's not rare. Probably somewhere in the 10% range of patients who've received Paxlovid will either develop symptoms, or if they would be retested after clearing, might come back with a positive test.
And then these rebound cases, I don't imagine them being very severe. And again, tell me why they happen. I mean, it just seems as if the drug puts it to a place where it's undetectable, and then once you are off the drug, it just becomes detectable again. So I don't know. I'm just thinking out loud here.
No, I think that's really a key thing that we're still trying to understand. But most likely, the antiviral properties are suppressing the load of the virus. But then once the medicine's out of your system, if your immunity hasn't really geared up enough to sort of continue that fight to suppress the virus, you can see a resurgence in the viral load that then allows the testing to be positive. Yeah, and there's kind of a technical component to this too, in terms of the thresholds that the viral load has to hit in order to make a test turn positive. So that's certainly part of this as well. Theoretically, if you may have the virus but not test positive, and at those low levels, there's really no risk or clinical significance either to yourself or to contagiousness, spreading it to others. But above those levels, there certainly is kind of the concern that you could at least be spreading it to other people. And I think that's why you see, for example, President Biden has gone back into isolation with his test turning back positive.
And Should a patient take Paxlovid if they're eligible? I mean, considering that
Yeah, that's a really good question. Paxlovid does have really good science and data behind its effectiveness at preventing someone from getting very sick and potentially needing to be hospitalized or even dying. So I think, truthfully, you shouldn't take Paxlovid if all you want to do is try to feel better sooner. But if you are a high-risk person who, there is real concern that COVID could become life-threatening, I think it's an excellent option. One of the best options at this point, particularly given some of the challenges with the monoclonal antibodies.
Okay, and then who is eligible? I mean, someone who's at high risk, right? They have to have at least one risk factor.
Yep. All the typical high risk conditions, whether it's your age, some of your underlying health risks, certainly people, who are immunosuppressed in some way because of either their medications or a health condition or something along those lines. But yeah, there's certainly the things we've identified throughout the pandemic as putting people at high risk are those who can most benefit from Paxlovid.
And any idea, Dr. Doehring, what's going on with the dosage of Paxlovid? Are they considering maybe having someone, a patient, take it for longer periods, higher dosage? I don't know. Is that underway at all? Or
at this point, it's a 5-day course. Whether or not that gets revisited, particularly if they maybe can identify certain subpopulations that are maybe at higher risk for the rebound phenomenon, that could change. But at this point, the guidance is still to stay at the 5-day course.
Wow. You just schooled me on Paxlovid. Thank
Not
you.
really.
Paxlovid. Actually, the first thing you did was tell me how to pronounce it correctly. So thank you.
That's right. Paxlovid. Absolutely. No, it's all good. Of course, the other treatment that we have for high-risk folks is a monoclonal antibody. There's still one that's effective and eligible, bebtelovimab. Unfortunately, the supply of that is quickly running out through the federal program. So we'll be seeing that probably transition to a more traditionally provided medication through insurance that has to be paid for, as opposed to being provided for free from the federal government. So.
Oh, wow. And then anything else I missed that you want to add?
Well, again, I think what we're seeing with the current dominant circulating subvariant, the BA.5, is that it is very contagious, but at this point, it does not seem to be, leading to huge numbers of folks getting seriously ill. And so that's where I think it is prudent to limit the use of some of these medications, whether it's Paxlovid or the antibody treatments, to those who are truly at the highest risk. And that can help, preserve those supplies for those who will most benefit from them.
Thank you so much. Really appreciate your time.
All right. No problem,
Okay.
Mary. Good to be with you.
Yeah, great to see you again, and see you soon. This has been Medical Minutes from Wish TV. I'm medical reporter Dr. Mary Gillis. Be sure to follow and subscribe to this podcast and check out new updates every week. You can also learn more at wishtv.com and when you follow Wish TV on Facebook.
This is the Medical Minutes Podcast with Wish TV's Dr. Mary Gillis. Be informed and stay connected for the latest news and information when you like, subscribe, and follow this podcast. And discover even more from the All Indiana Podcast Network. Now at allindianapodcast.com.